Okay, it looks like I'm streaming live. Welcome, everybody. Those of you who are tuning in right now, I've got about a minute or so. Well, I guess I'm supposed to be starting right now, but nonetheless, I'm going to be showing a link to my followers on social media. So if you excuse me for 1 second, tiny bit of sausage, as they call it, and then I'll be right back over here. Okay, let me make sure everything is good and set up properly. And let me show her live now. Of course, everything's going a little bit slowly. There we go. Okay. I'm going to do a tiny bit more sharing if you guys don't mind. Get over to Twitter. By the way, follow me, Facebook, Twitter. I'm out there sharing stuff. Okay. How are you guys? Let me see who's filing in over at YouTube. So I've got some people starting to come in. Welcome, welcome, welcome. And today I'm going to try. I tend to get long-winded sometimes, but I'm going to try not to go for the full hour because there's really something that I want to communicate today. And I know that your time is limited and there are other watching options out there all the time. But I have a take that I want to get across to you today. And so I'm hoping I can do it succinctly. I know we got Robert Nacier here in the chat over at YouTube, and he has his own show called 5 Minutes with Robert Nacier. And I know it's always longer than 5 minutes. My show, I usually slate it for about an hour, but I'm going to try to go much shorter today. Also in part because I got a surprise today. It was forecast to be rain, and it turns out we got sun outside, and I like to get out in the sun as part of my boost the immunity system COVID coping strategy. So I will be trying to zoom out there. If you are joining me live right now, you want to go ahead and give me a like and help this show get spread even further. That was much appreciated as well. Subscribe here on the YouTube channel. If you don't, then you'll get the heads up about when I am going live. I'm trying to, when I go live, try to go a little bit early and then do the posts out on social media just to give people a heads up. But if that doesn't happen, I think you will get notified if you ask to be notified over on YouTube when I stream live. I'm typically going live on Wednesdays and Fridays at 2 p.m. Eastern time, and I plan on keeping it that way for the foreseeable future. I'll give you a little just announcement, right? COVID willing, whenever this kind of dies down, I'm going to actually be moving my whole operation from Southern California to Texas. Yeah. I'll talk more about that in the future, but you know, even during those times, this is going to be a good time for me to do the show. So yeah, welcome. Thanks for the likes, you guys who are clicking over there on YouTube. It's very much appreciated, sharing and all that stuff. Okay, so let's dive in, right? Because I don't want to spend all day here. And so what we want to talk about is COVID exit strategies and some privacy implications of at least one component of the strategies, and the ethics of emergencies, in which case I'm going to be revisiting the essay in The Virtue of Selfishness called Ethics of Emergencies. And today, again, I'm so much impressed by Ayn Rand's brilliance. There's an example that she gives in here that just illustrates a point so perfectly. So, you know, people are all over the map with respect to Ayn Rand. I've heard people say they love the writing. This is Simon Le Bon. He said he loves her writing, but disagrees with a lot of the ideas. I've heard people say that they love the ideas, but can't handle the writing. I was speaking to a friend yesterday who said he couldn't make it through Atlas Shrugged, that it just wasn't his cup of tea. Simon Le Bon is exactly the opposite, right? So all over the map, but one thing is there is something in there for everyone, either in the fiction or the nonfiction. And the, like I said, the example, I was just struck by the brilliance of the example. So we'll get to that. So exit strategies, a lot of people are starting to talk about exit strategies for COVID. many of us are saying, okay, lockdown, I was into this for a limited period of time, but these, even though curves are bending and flattening and doing all the things that the politicians said is the goal, they seem to be talking about these indefinite lockdowns. And they talk about testing, but they don't talk about testing until way far off. CDC, we have this plan for testing, but key components of it aren't going to be implemented until summer. And we're sitting back saying, this is ridiculous. This is an emergency, yes. And so we should all, I think, be willing to be locked down for a limited period of time. And I'll talk about more why when we get to the essay. But we're saying, okay, we're restless. And so people are proposing various plans out there. What is the exit strategy from getting from this lockdown scenario and going back to normal life? What does that transition look like? How do we get there is really the question. Just got a little ding that I will turn off. Sorry, very unprofessional of me. We're all working from home and we're just getting more casual all the time. Uh, Part of which I was tempted to wear the headphones today. It's all messy. Everybody's got their COVID. Can't get to the hairdresser hair. This is mine. I thought it was going to be on cruise control, but not always. Oh, hi, Annie. Welcome. She says, I hope I'm feeling it. She hopes I'm feeling as great as I look. I am feeling pretty darn good. I have a little bit of ups and downs, but it all has to do with my quest for digestive health long term. And so, I have little blips in that journey because I'm actually trying not to be 100% carnivore. I'm trying to do things, and I'm also adding supplements here or there, and you can have blips, but overall I'm doing well, doing better today than yesterday, which is awesome. So thanks, Annie. So let's go into the exit strategies, right? What I've seen in the exit strategies is some combination of the following elements. You have first the tailored restrictions, carefully tailored restrictions. So you talk about people who are either low risk or who have already had the illness and have recovered, and that they've actually had COVID. It's not one of these cases where, oh God, I was sick for a day and my doctor thinks I had it, but I didn't have a test, and so therefore I must have had it. Weird. From what I've seen, there are people who are young and relatively healthy who have been knocked out from this thing with quite significant illness for a couple weeks. And why is that? There's all sorts of confounding factors. There's a lot that is unknown, right? So when you talk about these tailored restrictions and you talk about categorizing a whole swath of people as low risk and everything else, this has to be done with some caution, because I think that even those of us who consider ourselves to be relatively healthy, it's hard to be 100% sure. In my case, I have the, kind of minor autoimmune stuff that's going on, and with the, weird digestive stuff, and I'm underweight. It's like, I don't know for sure how I would handle COVID. It's possible. It's possible that I'm one of the people who's been exposed, but we don't know, right? So tailored restrictions, yes, with some caution. Certainly the most vulnerable people who we know have conditions that have landed people in ICU with this, or they tend to be in certain age groups, et cetera. Yes, those people maybe should be more restricted, and they should want to restrict themselves, and you should want to restrict your exposure to them unless you know more. Cautionary measures, would you be open to wearing a mask a lot in situations where you're going out shopping in stores and things like this going forward for a while? If we could get back to normal economic activity more quickly? Sure, I would. People are having fun with the masks out there too. Okay, great. I've got some masks coming, various kinds. I'm trying to just grab what I can, fabric or otherwise. You can make your own. Sure, that's good. Testing. I mean, as far as I'm concerned, we should have had blanket testing all over the place from now. I've been talking with people about why is it that we aren't seeing the testing just being unleashed completely. And I gather that one of the biggest obstacles now is not necessarily the regulatory blocks, that they're getting out of the way, but what's happening now is there are a dearth of supplies. So there's all kinds of different just testing supplies, physical supplies that need to happen. We've got the means to do both antibody tests and the sort of swab test for active infections that are necessary. I'm hearing now that there is a saliva test coming on board. So talk about, you don't even have to prick your fingers, just saliva from your mouth. I don't know how accurate any of these are, but this is a wonderful development. So the point is, testing, yes, there seems to be the potential to have widespread testing immediately. We have a government that is either set on keeping control over all of us and locking us down in a way that pits us one against another for the foreseeable future. Maybe it's some sort of plan or conspiracy, but the more benign interpretation of it is that there's this dearth of supplies, and that United States government officials don't want to admit that here in United States, we actually have this dearth of supplies, that we were caught flat-footed, that we can't actually implement all the wonderful testing strategies that are available and ready to go this second, and could give us all of this information that we need to narrowly tailor the continued lockdown measures that would be necessary going forward to make sure that we don't have this incredible spike again once we let everything go. Jose says the Ontario Premier just announced that he wants to increase testing from 1,300 to 13,000 daily. And one of the things I've talked about on various shows, and it's starting to all blur together, like our days in lockdown for me, because I've talked about it on so many shows, but wishing won't make it so. And intention is not going to make it happen. There are sometimes actual physical constraints to implementing testing as widely as we think it should be right now, because we're all stir crazy. We want to get our hair cut, right? Kyle says, masks are a great excuse to dress like superheroes with the kids. Oh yeah. And I mean, not just superheroes, but all kinds of crazy things. And I'm seeing these wonderful, they call them COVID classics, and people are enacting famous paintings and such. And then so it'd be, you're wearing this gorgeous gown from a famous painting and posing in the way that the woman is in the famous painting, but then you have a mask as well. It's, people are having a good time with this, and we can have a good time with this. We are human beings who can make the best out of a bad situation. And this is an emergency where it's appropriate, as I'll talk about in a minute, for us to help our fellow human beings, but we can do it with sometimes a sense of humor and, just go out and make the best of it. Anyway, so testing, right? Testing. So we've got tailored restrictions, various cautionary measures, wearing masks, continuing to wash our hands. You're going to be very careful. Some of us maybe who are more risk averse would be avoiding certain types of gatherings. And I was doing that before any of the lockdowns because I saw the writing on the wall, and I, because of my health struggles, thought I might be at particular risk, right? So we've got tailored restrictions, cautionary measures, testing, but given that there are physical restraints on the testing, wouldn't it be nice if we had something that could turbocharge the information that we are getting from the limited testing that we have? And there is such a thing. It has to do with tracking technologies. And we've heard to some extent that this is being used or had been used and maybe is still being used in South Korea, that's one of the ways that they got ahead of the curve. It is currently, as I understand, being discussed as a strategy going forward in the Netherlands. And even here in the United States, I don't know if you caught the headline because, there's so much out there, but there was a story recently about Google, that Google is, for those people who have opted into their location services on their cell phones, Google is releasing tracking information about people who have released it, location service wise. Now it's anonymized, right? And the purpose of the releasing it is for allowing them to see to what extent people are actually adhering to all of the lockdown orders and things like that. So it's not exactly what we'd want. What would we want? We would want tracking of the location of people who have tested positive for COVID, and then warnings to other people who have been in close proximity to those people, so that the limited testing resources could be used to test those people who had been in the same place and potentially contacted those people who were positive for COVID. I've railed in past shows, again, like I could remember which one because there's been so many. I've railed about the kind of double standard with respect to privacy that we have with our government right now. They want to get all the information for themselves. They give us very little information either about them and their activities and what they're doing during the time of the crisis and what they're trying to sweep under the rug during the time of the crisis. At the same time, they are also limiting, being way too restrictive on the information that they have about the people who have tested positive for COVID. We are all just, hungry for information about other cases, other people's experiences with the illness, so that we can assess what sort of thing we might be in for if we were to catch it. I've got one, friend who wound up in the hospital. I mean, David Latt, more of an acquaintance, but definitely on good friendly terms. He wound up in the hospital on a ventilator. John Taylor from Duran Duran, whom, I was a big Duranny as a child, he had it, and he reports it as sort of a turbocharged flu. I have people who are followers of the show who similarly, for one member of the couple, it was a turbocharged flu in effect. And then for the other, she had a relatively mild illness over a period of 4 days or something. So, well, I guess it wasn't totally mild, right? What they're calling mild isn't always mild. It's a lot of things, mild case of COVID. When I read what that supposedly feels like, it's something that I would want to go to a hospital for, as far as I can tell from experience, right? You just don't know. But we're looking for information. What comorbidities, what, other conditions does the person have? What kind of experience did they have? What did they do at home? What sort of over-the-counter things did they take? Did it make it worse? Did it make it better? We're looking for that sort of information. We're also looking for information about where these people were. So if your local health agency is reporting cases, and at the beginning they were tracking them a lot, they say, oh, it's community spread. Well, so talk to that person. Where does that person shop for groceries? Why not just let people know these things, right? Tracking technology could do this, and you can anonymize it, just like Google has been anonymizing the data that they've been releasing. You anonymize the data, but you release it, and you say, okay, Enric and Bree over in the chat room here at YouTube are talking about another thing that I have heard about as well: temperature reading and tracking. There is a company, I don't know the name, but they have electronic, digital thermometers. And one of the things that you can opt in for is to share the information with the company. And then the company can put a map out there and say, where in the United States are there a whole bunch of people running a fever? That would be great. Now, Bree says the total number of fevers is way below normal right now because the quarantine is stopping the flu. And that would be expected, right? I did not get vaccinated for flu this past season because I didn't feel strong enough to even take a vaccine for a long period of time. And then at a certain point, it was so late, I just said, okay, forget about it. But, because of that, I had been being very cautious this whole year. Now, Kyle says, how can we even have this data? There's all kinds of data that is out there to be had, either because the government agency is collecting it, or sometimes people are opting in to share data through various apps. What could we do now as part of this strategy, right? This sort of exit strategy? We can turbocharge the limited test results that we're able to get because of, and again, I don't have to have a nefarious conspiracy theory or I do think that we have some government politicians and bureaucrats out there who want to keep us in this bizarre lockdown scenario for a while so that they can flex their muscles a bit and show that they are worth something. There is some of that there, right? But for instance, Trump, Do I think Trump is trying to keep us in a lockdown forever? No. And it's not because he has any principled understanding of individual rights and freedom and that he wants to get us out there as soon as possible. I've seen some politicians make more principled statements like that. That is not him. What is him is that he wants to get the economy going as soon as possible and make the numbers look good so that he can win re-election. This is Trump, right? But, and maybe he's got a little bit of, yeah, the American way is to get out there and produce and be free, sort of in a very floating way. But he is not principled about this. Nonetheless, I do not think that he wants to keep us indefinitely in a lockdown. So what can you do? Yeah, they don't have enough materials, apparently. And maybe that, there is a certain amount of time that it takes to process the test results. So there are physical constraints to this. Turbocharge the test results. How? There are apps that either exist or could be designed to work for United States just as well as they've worked elsewhere, such that you will track the location of people who have tested positive for COVID. And it might be, this is something we could discuss. Is it a potential proper function of government to say, yes, if you have tested positive for COVID, there's going to be anonymized tracking of where you were and where you're going now and everything. And we're going to put that information out there so that other people can get tested and protect themselves, because this is an emergency. There's limited data out there. And I'm sorry, even your privacy right now is something that you're going to have to be willing to give up a little bit of to help your fellow man. It's an emergency. This is a horrible disease. They haven't completely nailed who it's going to floor and who it's not. And I would say sheer benevolence. I mean, certainly I would opt in. If I had been positive for COVID, I would probably post it on Twitter. I've been to blah, 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 blah. And normally I'm somewhat privacy oriented, but I'd want to let people know, if you've been to so-and-so places, and you were shopping for my favorite items, right? Because maybe I touched something on the shelf or whatever it is, right? I would do it. I would do it. So, I could say, yes, maybe in an emergency, it could be a proper function of government. Certainly, we could all agree if it was Ebola, right, that had such a high death rate, that it would be a proper function of government to require location data to be released out to people. And again, the beauty of it is we have this wonderful technology that allows this information to be shared very widely, but completely anonymized, right? So you can make it either pseudonymous, as the privacy term goes, where there's a link somewhere between the identity of the source of the data and the data itself, but then you go ahead and you move a step or two away from that before you report it out. Or you can make it completely anonymous, and that would be wonderful. So you could take all of the testing that's being ramped up right now and coming available. You can quickly mine it for useful information about who really does need to be tested. Where do we need to spend those scarce testing resources? And we can spend it quickly and get this thing under control and get people's lives back on track. We don't have to have everything locked down with the kids home from school completely for the rest of the school year. It could be a matter of weeks, right? And then you'd have maybe some people who would have to stay home because they potentially have been exposed, and you got to get them tested and get the results in and figure out the timelines and do it all very sensibly. And yes, I would err, even if we got free from the lockdown tomorrow, let's err on the side of caution and still go take all those precautions. Yeah, wear the mask for a while, laugh about it, whatever. It's maybe not the most attractive piece of apparel, but this is an emergency, and maybe it'll give you that added bit of security. It's going to make your fellow man feel more secure. Some of us have allergies, or occasionally I have a little bit of a cough because of the digestive garbage, and like I said, I'm doing different things. And so I try something and it has a negative effect and I'm coughing a tiny bit or something, and then it's gone the next day. But I don't want to make my fellow man nervous if I'm out in the world. Or I was in a Walmart and sneeze because it's cold, right? Now, if you sneeze, because they have it very chilly, and there's like huge sections of a huge swath of frozen and refrigerated area in Walmart. Temperature change, you sneeze a little. You don't want to make your fellow man nervous. You're wearing a mask. You're going to make them more comfortable during this time. Let's all do this, right? Let's get things going. And there already have been some businesses that are suffering, and some AMC I heard might potentially go out of business permanently. It was ailing anyway. Maybe that'll still happen. Do I think government should bail companies like that out? No. But let's help. If there's a business that you have a stake in, a local business, go help them. Order to go. Just throw them a little bit of money, whatever it is. Let's figure out the best way to get going. But these are all the strategies that I see. And, I'm the privacy advocate forever. I've always said that if you share information with a third party like Google or anybody else, it shouldn't be, for sure transmitted publicly or even given to government without a warrant based on probable cause and particularized suspicion. But as I'm going to go to, here in a second, this is an emergency. And just as Ayn Rand talks about in the essay that we're going to talk a little bit about in a minute, Ethics of Emergencies, she says it is ridiculous for all these philosophy professors to start out an intro course in ethics and say, let's derive the rules of ethics from some lifeboat scenario or some Speluncean explorer's example, as it happens in philosophy of law classes. You don't derive normal principles of day-to-day ethics, day-to-day life, or day-to-day prescriptions for rules about the proper legal protection of privacy. None of this comes out of an emergency, right? And similarly, when there is an actual emergency, and I say this is an emergency because there is just too much unknown, and it's not a normal flu, and there's no vaccine that people can use to protect themselves, and our governments have messed up. Our governments have made it more of an emergency than it needed to be. A lot of your fellow human beings, people right in your neighborhood maybe, are at risk. People that either you personally care about because you do know them, or people that you have held in high esteem, particularly our frontline healthcare workers. These are people that, that people sort of in my intellectual bubble have wanted to do a lot of wonderful, good things, fighting for the welfare of these people for a very long time, trying to do things to fight against more government takeover of medicine, for example, because it has destroyed the rewarding aspect of the career for so many doctors. I've seen so many doctors retire and go into real estate investment or who knows what other types of things. I saw pathetically, there was a one specialist that I had to see several years ago. And he talked about having planned on retiring, because he was sort of in the end of his career. He was going to go ahead and practice through the end of his career and then retire. And he had planned to retire at a certain age. And then he found he couldn't because government restrictions were making it so that he was able to make only less and less money, and he couldn't save as quickly for retirement as he thought he could. So many of us who are freedom loving and who have seen the danger of Obamacare, for example, to destroy our healthcare system even further than all the other decades of government intervention, we have spent quite a bit of our time, energy, and resources trying to protect these people. Of course, during an emergency like this, we are willing to stay home for a few weeks to, yes, flatten the curve so that these people are not themselves placed at danger, because from what we know, viral load might be another factor in this big equation that we're all learning about all the time. Who's getting the biggest viral load? Healthcare workers who are dealing with the worst cases of people spewing virus on them. And they don't have enough protective gear, again, because there are physical constraints at play due to past decades of government intervention and ineptitude. It's an emergency. Yes, it's an emergency. So, we'll do that. And similarly, I will say that my usual prescription for what should take place with respect to data that you share with third parties, it doesn't apply for this limited time. Now, this is not a license for government to lock us down forever and for Newsom to sit up there all smugly, oh, the curve is flattening, but it's also stretching. So, I'm not going to give up control and my spotlight and my smarmy, publicity op-eds and opportunity moments or whatever, camera ops. I'm not going to give that up quite yet. I want control and I want to be able to enact more of my idealized progressive agenda and destroy California further. No, there is some of that. They don't get to do it forever. Patriot Act after 9/11 is a huge example. No, we draw a line, but nonetheless, it is an emergency. There are different ways of looking at what the ideal political response is, what the not ideal, but best available to us political response is today, given that in effect, we are all, those of us who are freedom minded aren't really addicted to government interference, but our system is like a drug addict right now. And the analogy that I made on Twitter the other day in my thread with the poll that I had posted was that if right now we went cold turkey on government interference and didn't use it as a tool through this scenario, regardless of the fact that there probably is a proper role for government in an emergency like a pandemic, if we just went cold turkey on government interference, we're going to have massive casualties and suffering. We're not advocating, a lot of us are not advocating for that. In the case of getting rid of Social Security, what are we in favor of? A phase out plan. Yeah, so again, limited lockdown. In my hierarchy of values, I'm willing to stay home for a little while, both for myself and to act benevolently to the people whom I value either in the concrete or in the abstract throughout there. Those frontline healthcare workers are huge, and you can't just say, oh, yeah, we should all go on with our lives, freedom, and then at the same time say, I'm going to make up for it by, putting some essay up about my healthcare workers and how much I value them, or even that you're going to donate a little bit to help healthcare workers, or that you're going to go to a hospital and put a sign up or something. If you go to a hospital and put a sign up, oh, you guys are heroes and we value you, and then the next moment you go to a mosh pit at a concert, you are not walking the talk. And I'm sorry, walk the talk a little bit here. I value those people. I don't want them to be put into heart-wrenching decisions. Thankfully, as far as I can tell, it looks like we are going to actually succeed in flattening the curve. That in maybe most areas in the United States, it's not going to be a situation where a doctor has to decide who gets the ventilator. Can you imagine being that doctor? And these people don't deserve it. It's an emergency that they're in, that they're going to potentially suffer again through the increased viral load of those people, and also the conditions of work psychologically. Help them, right? Help them. So that's my case on shouldn't we do it. So I've been thinking a lot about ethics of emergencies, and actually it was Benjamin, my friend, who first kind of turned the inference on kind of backwards, and it really is one that you turn both ways. In this essay, Ethics of Emergency, which is the third chapter of Virtue of Selfishness, Rand talks about, again, how ridiculous it is to try to derive your ethics from emergency scenarios, because it's just not the case that life is a constant source of emergencies and catastrophes and doom and gloom. And here, I want to give you the example. This is how brilliant this woman is. She's talking about on page 56 of this edition of it. I don't know if it changes from different editions. She's talking about whether it's a benevolent universe, one in which success and prosperity, and a good life is possible for human beings as the norm, Is it that, or is it a malevolent universe, as she calls it? That by our very nature, we are as human beings, as she says, quote, helpless and doomed, that success, happiness, achievement are impossible, that emergencies, disasters, catastrophes are the norm of life, and that human beings' primary goal is to combat those. We reject that. Now, one of my objections to Jordan Peterson when I was analyzing him was that he was too much of the doom and gloom. And it sounds like he has had quite a bit of tragedy in his own life. And it is easy for those of us who have had, struggles during our life to, like I said, I've talked about this with respect to don't let it go, right? Don't let it go is create, kind of maintaining the American sense of life in your mind. And I've talked about kind of struggling with that a little bit personally, because I did have, a lot of difficult times growing up and otherwise. But we keep our eye on the ball. And let me give you the example, right? This is Rand's example to just make very clear and concrete for you right now that it is not a malevolent universe, it is a benevolent universe. She says, as the simplest empirical refutation of that metaphysics, she means, the malevolent universe metaphysics. She says, as evidence of the fact that the material universe is not inimical to man, and that catastrophes are the exception, not the rule of his existence, observe the fortunes made by insurance companies, right? Insurance companies could not make money if life was one unending disaster after another. It's like, okay, we're just, now it is true that we do have to accept that there are going to be challenges in life, and we have to develop the resilience to get through them without having them have so much staying power. And there's all kinds of techniques that you can use to make yourself more resilient in the face of the ups and downs that do happen as part of life. But it's not a constant. It is not the normal state of human existence. Otherwise, insurance companies would never make any money. Oh, people are talking about a lot of the information that they've heard about coronavirus here in the comments in the chat room. So thank you guys. Heat and humidity tend to suppress the coronavirus. That's one thing that I have heard. 90-degree in humidity, they say no effect on coronavirus, right? There's so much grasping at straws out there. There's so much that's still unknown. And I feel like, yes, there is a certain amount of time that we need to spend during this time period each day thinking about what is the latest bit of information about how to protect us and those we care about. And is it credible? What evidence is there for it? And, how much you are willing to incorporate into your daily life in terms of how many supplements are you taking. I'm joking right now because I've got this stash of supplements between just normal health maintenance, me trying to rehabilitate my gut, and boost my immune system for coronavirus. You can only swallow so many pills in a day. Getting out in the sunshine and walking, torture me, right? That's wonderful stuff. Meditation I've taken up during this time. I was doing it before the lockdown started that, and it's quite helpful. Eat a lot of meat. I was doing that anyway, but you have to decide, how many times can you wash your hands before they're rubbed raw, etc. So yeah, let's get that information and do it. Jose says, does she also talk in that essay how in emergencies it's each man for himself, or that somewhere else in relation to being in a dictatorship? She does not speak that way in this essay, okay? In this essay, there is not as much emphasis on the, helping out your fellow man during an emergency as I have put forth during this show, but she was writing it in a context of trying to answer those people who think you can derive your ethics from an emergency. Nonetheless, she does talk about how it is proper that you should, she uses the word should. I've joked before about, my grandmother, she used to say, don't should on me. And there are a lot of situations in which it's good to tell people don't should on me, but she actually uses the word should. This is on page 55 of Virtue of Selfishness. She says, and she's mentioning it, kind of in passing. She says, the principle that one should help men in an emergency cannot be extended to regard all human suffering as an emergency and to turn the misfortune of some into a first mortgage on the lives of others, end quote. She's saying it's a principle. One should help men in an emergency. Yeah. Now, of course, she says, don't sacrifice yourself, that you need to put whatever efforts you're going to do to help your fellow man in an emergency into your proper hierarchy of values. But I submit that if you are in touch with the tremendous value that, for example, our healthcare workers are for us, certainly we can all put forth the effort to help them. Maybe you know some healthcare workers personally. I have friends who are doctors. I have a niece who is on the front lines as a nurse. I have other friends who are nurses. Um, I People are asking me specific questions. Do I have, do I know the value of Z packs? And, I think Z pack, they use it alongside the hydroxychloroquine, and that's a good treatment. But you have to go look at the experts and what the latest data is. Some people say that you can't trust the hydroxychloroquine, whatever, because it's Trump who said it. And then they say you can because Trump said it. Both of those are wrong. You got to talk to the experts and the evidence that they've got to put forth and evaluate it. In any event, we all need to look at our proper hierarchy of values in evaluating. And again, page 55, Ethics of Emergencies in Virtue of Selfishness, Rand says, one should help men in an emergency. You should. Now, the extent to which you should help your fellow man in an emergency, again, depends on your proper hierarchy of values. And one of the things that I've been doing again in these shows for the past weeks is talking about the sort of calculation that I go through and that I think might be similar for a number of other people. It all depends on what you think about you. I factor my own personal sort of insecurity that I would have an easy time if I was to be infected with coronavirus. I have seen a number of cases, and I, myself, I don't even relish the idea of a turbocharged flu, which is supposedly one of the types of mild cases that you could have of this. So you weigh that, yeah, staying home for a little bit to kind of see what happens and learn more about this. Not so much of a sacrifice, especially when you consider that you could help a whole bunch of people who maybe have a comorbidity of some kind, or they're older, they're more at risk. They have this through no fault of their own. And, the mere fact that you could look back and say, oh, 90% or 99% or whatever it is, that they had these comorbidities, it doesn't mean like you want them to die because they had diabetes or something or whatever else it is. Normally we would like to help save people. Again, if it's not a sacrifice, AMC is going to go out of business, but are all the people who worked for AMC going to die and have no life? No, right? It's an emergency. So yeah, some sort of a limited tailor measure, but again, continuing on the quotation from 55, yeah, one should help men in an emergency, but that cannot be extended to regard all human suffering as an emergency. And one of the things she talks about in the essay and emphasizes is that the goal is to return to normal situation, the normal situation in which you do apply the standard principles of everybody has freedom of movement and all the other things. You want to get back to that as soon as possible. And there is enough information out there to, I think, probably do it within a matter of weeks from the best, again, this is me making my best judgment. I'm not an expert. I laid out the factors that I think are at play here, but I could see us getting out there in a matter of weeks with a tailored strategy such that maybe we're all wearing masks and laughing about it for a while. And some of us are still staying home, either because of our personal preference or because there are actual restrictions, I think, that should be made with regard to people who have been tested positive for COVID, or there's a known exposure and they haven't gotten through the incubation period. You might order those people to stay home for a little while longer. And that's appropriate, maybe even a proper function of government during this emergency. Yes, but get as many people as possible back to work while still protecting those healthcare workers while still protecting the vulnerable people, this could be done. Tailored restrictions, cautionary measures of various kinds, testing, tracking. Tracking will help turbocharge the information that we get from the limited testing that we're able to do. Why? From what I gather, again, it's not some nefarious strategy. It is because there are actual physical limitations, either supplies or the testing processing time or whatever it is. Let's put everything together as quickly as possible and get people back out there. The growth rate of some statistic has gone from 31% on March 15th to 9% today. The thing that's so difficult today is that it's hard to figure out what a denominator is. What's a denominator truly? Have I been exposed to it already and I was, asymptomatic or had minor symptoms such that it didn't unequivocally show up as COVID in my life? We'd have to have antibody tests to know. Josh says, yeah, 100% safe is not the goal. No, 100% safe is not the goal. And what you want to do is you want to minimize it and engage in as many of the non-sacrificial things you can do to help your fellow man during this emergency as you can. It is proper to help people in an emergency. But it is also, what is the strategy? The strategy is to help people during that emergency and work at the same time to get things back to normal as soon as humanly possible. And I definitely think we can do that. It seems we've been on the lockdown for a couple weeks now, at least, maybe 3 weeks in some places. I don't think more than 3 weeks in most places, maybe a little bit more than 3 weeks. And as I understand it, the statistics are starting to come in that effort has had an effect. This is awesome. This is beautiful. We should cheer it. And no, Gavin Newsom, you're gruesome to go out there and say, oh, well, the curve's flattening, but it's also stretching. And so, yeah, I want my spotlight a little while longer. I want to feel important. I want to feel like you're dependent on me. I haven't quite gotten what I wanted yet. I guess it's, the fuel of a narcissist or whatever he's doing. Sorry, I'm psychologizing, but I'm mad at him. Don't do that. Don't. And those of you who are arguing against any sort of lockdown having been appropriate at all, don't use your disgust with someone like a Gavin Newsom, your frustration with someone like a Donald Trump, who is maybe allowing himself to be pushed further along the lockdown strategy, and he's groping, he's not getting quite the right strategy, exit strategy, whatever. Don't allow that frustration to throw the baby out with the bathwater, because I do think it is perfectly consistent with a philosophy of rational self-interest to apply in this emergency the hierarchy of values of a lot of people, to want to take significant measures, provide significant help, significant cost. Yes, it's a cost. It's a cost for many of us to stay home during this time. And for some people, I think if it is really too much of a cost, maybe there are other people who would be willing to chip in and help those people financially so that it's not as much of a burden for them. Everybody, to the extent that you can, don't begrudge helping your fellow doctor and your fellow human being get through this emergency in the short term. At the same time, we have got to push for the right solutions. Let's push hard for a combination of these tailored restrictions, continued cautionary measures, testing and tracking. And, don't think that if they lifted all the COVID restrictions tomorrow, that you could just go, like I said, back to the mosh pit at the concert or your spring break on the beach in Florida, or, go around and start shaking hands again with people. I mean, I'm hoping that shaking hands is kind of going to be a little more of a wary gesture in the culture going forward. It's not going to be the worst thing in the world if we've got one of my doctors, he was always doing this before, and he would call it the flu season thing, but every time I went there, he was doing it. He would elbow bump his patients. He would never shake their hand. And a lot of times, the doctors, it's like you love them so much for what they do for you, you want to hug them, but you're like, okay, elbow bump. You want to protect them, right? And you value them. We've all shown that we valued our doctors, those of us who are freedom minded in the past, by willing, to donate and do all sorts of things to fight socialized medicine. Why do you want to do it? Because you want to make their working conditions better. You want to preserve this healthcare system that you're probably going to be in need of at one time or another. And you know the right way to do it. Well, it happens to be in an emergency. One of the right ways to keep these doctors alive. Too many doctors have died, nurses as well. Too many of them have died, I think, because of the high viral load. And in addition, probably they're working under a lot of stress. That doesn't help your immune system. And again, those who are surviving are facing a lot of horrific choices and situations. It sounds terrible, and we want to prevent that. It seems that we have done a lot to prevent it. And I'm so excited about that. And I want it to continue. At the same time, yeah, we should be able to ramp up and get back to some sort of work, some sort of phase in strategy as soon as possible. Let's fight for it. Let's do it. Anything but jazz hands. Am I doing jazz hands right now? Am I doing jazz hands? I'm excited. It's possible. Spirit fingers. Oh, you're talking about what's going to be the substitute for the handshake. People were talking about the bow. And I've done something like that, I think, in situations where maybe you're at a big table at a restaurant and somebody walks in and you can't really reach all the way to the end of the other table and shake their hand, but you just kind of nod. That's fine. Lots of people's lawns are mowed nicely right now. Yeah, I mean, there are a lot of people who are using this time to take care of their house and stuff. Actually, I've got a bunch of house cleaning that I'm behind on because I've been doing all sorts of other intellectual activities, and I need to get back to the physical a little bit. But yeah, a lot of people are renovating and doing wonderful things, maybe planting gardens. Curtsy, says Jose. Yeah, you can curtsy, you can bow. These are all nice. Rand Paul is volunteering at a hospital now that he's better. He doesn't even need a mask. Now that's the thing, right? Is that a stunt, right? Because I would not be. Maybe he knows something I don't, but there's been the rumor that there are 8 at least different strands of coronavirus, and that the fact that you had it and you got better, it could provide you immunity for a limited time. Somebody speculated maybe as long as a year, but potentially, suppose you had one strain of coronavirus and you caught another strain, you were exposed to another strain during that time of immunity, potentially you could get a little sick still. And, one of the things I wanted to say about, I'll have a mild case at best and it's just the flu. Even the flu can kick your butt, right? And some people have a flu that turns into pneumonia. And even a mild pneumonia can have some long-lasting damaging effects to your lungs. This is, it is more within your interest maybe to use caution with this. We're starting to get enough information, both about the risk to ourselves personally and ways to incorporate testing information and make it useful so that we could do targeted testing and all get back to work. We can do it. We can make our own choices within that sphere and have governments start to get out of the way, not only of the immediate essential things that are required to tackle the emergency, but get out of the way of people making their own decisions about how to get back to work. We are, I think, are close. We have the information. Let's do it. Greater risk driving than flying. Yeah, we've all got all that kind of thing. Some would recommend a simple wave with your arm fully extended above your shoulder at 30 degrees, feet together. Oh gosh, I'd have to see that, but I'm starting to picture it and I'm wondering what it is. HCQ zinc tablets, put them over the counter or something. Oh, I don't know. The hydroxychloroquine has a causal mechanism that's been explained that makes a lot of sense to me. And in fact, I had heard that hydroxychloroquine was being tested for Hashimoto's, which is the autoimmune thing that I've been diagnosed with in the past. But it's been used for rheumatoid arthritis and other things as well. So it's plausible, but everybody have to go do research on this. And let's hope that anybody who's listening right now who has not yet gotten coronavirus maybe won't do it. From what I understand, a lot of people think it's inevitable that a bunch of us get it or be exposed to it up until the point where there is so-called herd immunity, which would require more than 50% of the population to get it. Is that really true? Is it unavoidable? I don't know. I don't know if it's unavoidable any more than our decline towards totalitarianism is unavoidable. Again, I'm out here doing "Don't Let It Go" as a show title for a reason. Try to fight all these things, right? No one is talking about how COVID rules are affecting love, sex, and romance. Some people are talking about this. And in fact, Lady Gaga yesterday was trending on Twitter because she had done an interview in which, and she's doing a benefit concert and everything, one of these online benefit concerts. There's a lot of good online music, by the way. Tamir Hendelman, a wonderfully talented jazz pianist, had his first online concert during this time period yesterday. It's at stageit.com, where you can go. And there's probably a whole bunch of other artists that you like who have already gotten accounts up on there. So go check it out. But Tamir, I've known for decades and followed his work, and even had the pleasure of having him and his wife in my home in Colorado years ago. He's so talented and just benevolent and wonderful. And he did an online concert, and I got to watch Tamir live, and it's almost as if you're sitting in his living room with him. So do stuff like that too. It's wonderful. But how are these rules? So what is Lady Gaga doing? She's doing one of these concerts, and she is talking about how everyone's using the catch slogan, we're all in this together. And she's saying that unfortunately, we're not all having the same experience of the lockdown. There are many of us who are very fortunate to have, in effect, a rather benign or pleasant experience during this lockdown period. Some people are using it as an opportunity to try things from their house that they wouldn't try before, maybe like these online concerts that Tamir is doing and other stuff. But there are some people, unfortunately, who it just so happened they were out of luck and they had not yet escaped an abusive relationship, for example. And Lady Gaga was talking about women in particular, and it makes sense because women statistically are less physically strong than men and therefore are more at risk if they are trapped. Imagine being trapped in a quarantine environment with an abusive partner, and imagine being the physically weaker partner of the two. The physically weaker partner and, the victim of the abuse, the other partner is the abuser. There's a JP Sears clip out there, which is kind of funny. It talks about something like how to destroy your relationship in a quarantine. And he and his wife, of course, are quarantining with everybody else, and they're using it as an opportunity to make funny videos. And this is the wife being abusive of him, essentially. But it's fun. Conspiracy theories. Of course, there are some people. Can I explain the psychology of conspiracists? I can't explain the psychology other than that maybe it's a place for the anxiety and the fear that you feel to externalize it somewhere. So there's two things that I've seen in terms of more of an overreaction or conspiracy theory, where I would tend to put a more benign on the human one. The one is that, of course, our leaders are, 201, all of them trying to use this as an opportunity to bring Orwell's 1984 to life right now. It's like, okay, we got coronavirus, let's go. As I said, I was explaining earlier, while I don't think that Trump's motives for wanting to get us all back working as soon as possible, they are not the same motives that you and I would have. I do think he has those motives, that he is not trying to have an indefinite lockdown. Probably there are certain aspects to a lockdown that he wouldn't mind, because he does have a little bit of the dictator envy that we've seen that he's done in the past. But by and large, as far as I know, he is aware that if the lockdown continues, the economy is going to suffer more than it already has, and that's going to dampen his prospects for reelection, and he wants to get reelected at the very least. So no, I don't think that there's that. I do, like I say, I really rail on Newsom here in California, even to the extent of psychologizing him a little bit. I apologize for that, but I'm angry. I feel, I'm a native Californian, and I feel he is destroying further a tremendous value that's already been destroyed to a large extent by a long row of politicians behind him. Some people are avoiding emergency care out of fear. Yes, says Benjamin. I was talking about that a little bit yesterday too, that some of the case studies that I've read, and they talk about what their mild case and they stayed home the whole time looks like. I would want to go to the hospital. But yes, I would be torn about when I would feel safe going to the hospital. It's scary, right? The prospect of being put on a ventilator is a scary prospect. As I understand it from David Latt, though, that he hardly remembers. So they did have him, sedated or made comfortable in ways that didn't make the actual experience that he had horrific. Although some of it was probably not comfortable and quite scary. Yeah. So yeah, you don't want to avoid, but yeah, no, people are avoiding it. Yeah, so people aren't all experiencing this in the same way. And so Lady Gaga was going out of her way to try to have a fundraiser to help victims of abuse during this time period. If anybody is a victim of abuse during this time period, I would hope that, first of all, that you can survive it with as little suffering as possible. There's got to be a way, hopefully, for you to get out and maybe go quarantine with a family member or a friend who values you. Maybe there's a way to escape even during this time, right? But secondly, if you are a victim and you are seeing maybe things about your relationship that you didn't realize, et cetera, that you can use it as a wake-up call. If you have an abusive partner and get out. People have their tipping points, and maybe for some people this will be an opportunity for growth in a different way long term. Josh is saying, is the 0.02 to 1% mortality in an emergency? I have not seen that proven. And moreover, who is the 0.02 and 1%? We've defended a different type of 1% before from an unjustified attack. And this is an emergency. We don't need to sacrifice. I understand that you have gone under tremendous hardship yourself, and I think you are a worthy recipient of donations from other people to make the stay home period less of a sacrifice for you, because you actually are, because of the system being designed the way it is, perhaps sacrificing to stay home in this emergency time. But I'm sorry, Josh, it's an emergency. And there are worthwhile people. And it's not just, again, the mortality. It is saving our doctors and our healthcare system. But the mortality itself is something that again, I think we all should be willing to use substantial efforts to help people. What is the child mindset? What is the child mindset? I want to hear. I've got someone here saying that there's what is the child? You have to elaborate, because there's a 20-second delay, and I can say a lot in 20 seconds. So if you say that, I don't know what that is referring to. You're worried, Jennifer, about people being afraid of each other for a long time. I'm not so worried about that, because I do think that given the proper sort of tailored restrictions. It's so funny that I saw that made me think of, there's a guy out on Twitter who says, what was it, like COVID positive or whatever, and come play with me. So all the people who have been COVID positive in the past, they all get together. There's going to be ways. Someone's addressing the issue of acceptable deaths in the manner of a child. I'm addressing the issue of acceptable deaths in the manner of a child. So if I was sort of more worldly, then I would say a certain amount of deaths are acceptable. Is that it? So we're going to talk about the sheer quantity of deaths. And so you're taking my position as the position that I would accept 0 and that's childish. Is that what you're saying? I can't pronounce your Avi, your tag, because it's all mostly consonants. There's a difference between an 80-year-old getting 3 more years in a hospital bed. That is not true of all these people, and I will give you David Latt. David Latt is a 44-year-old, 3-time New York City Marathon finisher, dad of young child, and he is going to have a lot more than 3 more years in a hospital bed because there was a ventilator and various experimental drug treatments available to him. Yeah, acceptable deaths is the type of reasoning a ruler would apply. I agree 100%, of course, Benjamin. You know, again, there are people who are facing this unprecedented virus through no fault of their own. It is a fault of, you know, again, the people who had the unsanitary practices in Wuhan, a fault of first the Chinese government that was doing the cover up, then the ineptitude of our own government not getting ahead of the curve long enough. Okay. And perhaps there are certain things that, yes, our federal government should have had on hand, like supplies to implement whatever testing strategy becomes available, et cetera. Those should have been stockpiled to a lot greater extent that they have. There's a lot of things our government has done to make the emergency worse. And the emergency, it's like a huge tornado, and it's going to impact 2 people or 2 categories of people disproportionately, unfairly, and tragically. One of them is the so-called vulnerable population, the only 0.02 or 1% or whatever. It's only them. It's only the 1%. Screw that. I stood up for the 1% when the 1% was Bill Gates and Elon, well, not Elon Musk, sorry, he does government stuff. You know, but Jeff Bezos at Amazon and stuff. I stand up for the 1%, and I'll stand up for this 1% in an emergency. It is an emergency. It's a delimited period of time where, oh my gosh, you have to stay home for a little while. So sorry. In order to avoid, and again, you don't know who that 0.02 or 1% or 3% or 5% or whatever it is going to be. You don't know who that is. They were making decisions in Italy, for example, where sometimes, and there was a case, they denied a 52-year-old woman a ventilator because that's how bad it had gotten at that point, where 52 was too old to be put on a ventilator. So screw that. Yeah, 25% of positives are medical workers in New Hampshire. Yes. Don't we want to reduce the viral load for medical workers? That's one of the things that you're doing. Not just the viral load, again, the psychological load, as we might call it. We want to reduce the viral load for medical workers. We want to reduce the psychological load for medical workers. We don't want them to be put in the positions where they're having to make these decisions. And where do you think you're going to come out when you're rationed? Maybe if you are part of the political class, when you get to the hospital, you're going to have priority because you're in the government or something. I'm not so sure. I criticize the government all the time. Right? I want all the resources available for me too. And I want my doctors in tip-top form if I get there. I don't want them beleaguered, cynical, sick, dead. Same with the nurses, right? And it might be that the best and hardest working nurses are the ones getting the most viral load right now. I don't know. You know, this is in your hierarchy of values. That's all I'm trying to say. And, you know, you have to search that for yourself. And if it's not in your hierarchy of values, to stay home a little bit or to be extra cautious and et cetera, to actually just go out of your way to help people during emergency for a little while, that's you. And I can understand railing against it because we've got Newsom Gruesome here in California and he makes me ill. But the fact that he is trying to force the lockdown on everybody and do all this draconian police force. And they have actual graphics telling you, dial or text to whatever phone number and report your local restaurant for being in business. This is all disgusting, right? And this doesn't have to happen. Again, there's a tailored exit strategy that we can do, the combination of the restrictions, the cautionary measures, the testing, and yes, the tracking. Give up a little privacy for a while, get everybody moving. We can do this, but we have not been wasting our time. I don't think generally it's been a sacrifice. If you have undergone hardship, then ask for donations, and probably there's plenty of people willing to help. I can tell you that when I did the poll numbers, and the poll number doesn't prove what's right or wrong, it just proves what the people out there think is their hierarchy of values with regard to handling this crisis. I asked the question, if you could be free of the lockdown tomorrow, if they lifted all of the mandatory lockdown restrictions, would you stay home a little while longer, or would you go outside? Now, they didn't allow me to elaborate in interesting ways in the Twitter poll. There's so many characters you have for each option. And so I said, please elaborate in the comments. But 55% said they would stay home a little while longer. And a number of them said it was because they were also concerned about their own health. I think there's enough unknown about this virus that, yes, even you, I don't care how young you are or how healthy you think you are, and you're not going to be part of that 1%, they don't know enough. And there's weird things that are in a person that you don't necessarily know about that can start the so-called cytokine storm or whatever it is. And suppose all you have is a case of the flu. The flu is non-trivial either. So it's, anyway, that's all I can do, right? I can just tell you part of my calculations, the way I see it, the types of values that are at stake, who we're protecting, and that yes, it is proper. You should help people in emergencies, but I can't tell you how to order your own hierarchy of values. That's the thing you have to do for yourself and figure it out. But yes, it is proper. I think we have done it, which to a certain extent, some of us under compulsion, some of us out of choice, still cheer the results nonetheless. And yes, it's time for government to figure out how to quickly get out of the way, not only of the entrepreneurs and heroes who are trying to solve the problems, get out of their way, but also get out of the way and allow people to make rational decisions about how we go forward. To a very large extent, we can tailor narrowly the mandatory lockdowns given the information and the technology that we have. And there's a lot of information that's out there that people can use to evaluate their personal risk and the risk that they might pose to the individuals that they actually physically interact with and care about. So let's do this. That's my piece. Unfortunately, I did go over an hour. Sorry about that. But I'm looking forward to continuing discussions with you. I've got James on Friday here for None of the Above. Maybe he's going to watch this show and tell me why I'm all wrong, and we can have a discussion about that. Or maybe he's going to elaborate. I'm going to ask him probably about his personal hierarchy of values. He has a mother. My mother, unfortunately, died in 1995, so she's not around today. My father, he lives on the East Coast, and so I don't have an opportunity to personally interact with him, but he's a dialysis patient, regular. Before this, he had a problem with his kidneys, and yeah, flatten the curve for him in the East, because people who aren't even sick with COVID are being put at risk of catching COVID if they just go get their regular dialysis. It's a whole nother group. Anyway, enough rant for me. Sorry about that if I got a little heated, but yeah, I'm passionate about this, and I'll talk some more with you guys on Friday. Okay. Ending my meeting. Thank you for tuning in. Someone says, I've lost my job. I am in unemployment. Now, I don't know particular situation, Jennifer. I thought you had lost your job before, but I'm not sure. Anybody who's lost their job now, again, I think is a worthy recipient of any kind of charity that other people who can afford to spend more will. Yeah. So, again, help out within your hierarchy of values. Everybody judges it for themselves. And all I've tried to do here today, passionately and maybe sometimes angrily, I'm sorry, is argue for certain things that are at risk in this emergency to be given a little bit higher priority in your hierarchy. But you have to decide for yourself. Take care, everybody.